Welcome to Adapting Class. Let's review urinary tract infection and kidney stone. This is always confusing. It's very good. This lecture is very good for simple questions, standalone questions, and NGN, intentionally done in case you find these cases. They always will let you distinguish between them, but this is key. Listen to this lecture and you'll be golden. Before that, let's look at test-taking strategy on this question. Which of the following the nurse should suspect the client is taking? A client called the outpatient clinic to report of what? Brown, yellow urine after starting a new antibiotic. Which of the following the nurse should suspect the client is taking? This is a test-taking strategy to let you start thinking about questions before you even look at the answers. What is the buzzword? I've underlined brown, yellow urine, right? And the patient started a new antibiotic. Which of the following the nurse should suspect? Well, before even I start, I have to make sure that I'm dealing with an antibiotic. Is there any antibiotic here? This is an antibiotic. This is an antibiotic. This is an antibiotic. This is not an antibiotic. Although you turn your urine what? Orange, red. Therefore, I've eliminated this. Then I go to the first one, rifampin. It turns your urine orange, red when it's normal. When it's bad, it forms T-callate because it affects the kidney. No, the liver, right? So that is a problem. Isoniazid, it turns your urine T-callate when it affects the liver. It's a TB medication and it's an antibiotic. The only thing that causes brown, yellow urine is nitrofurantoin, an antibiotic used for what? UTI. So these are the things, this is the way you approach question. Figure out what you need to answer and see if there's antibiotic. There's no antibiotic, you eliminate it. 3 antibiotics, see whether they meet the criteria of the question. And if they do, you pick it. Test-taking strategy by Adapting Class. Take care of yourself. And let's review our content. Our content is we're going to talk about UTIs and then kidney stone. So urinary, as people call it, urinary tract infection. So that's the UTI. There's 2 types, okay? There's a lower and an upper. This is caused by bacteria infection. I'm going to give you straightforward infection. Bacteria infection. The way you should remember is the lower one is cystitis. I will explain it. And the upper one is what we call pyelonephritis. This is your urinary system anatomy. The kidney is 2 being structures here. It's connected to the bladder by this urethra. When you have infection involving the kidney itself, this area, this is what we call pyelo. It's bacterial infection, that is the pyelo. When just the bladder is infection, which is the lower portion of the urinary tract, we call it cystitis. The cyst is the bladder, an infection of the bladder. Nephrolithiasis, okay, nephritis is the kidney infection by bacteria. So when we say lower, we mean cystitis. When we say upper, it's pyelonephritis. That concept, if you get it down, you understand every question they're going to ask you. The most common bacteria is E. coli. This E. coli is also in the gut, so your GI tract. This is the main reason why we try to let you wipe from front to back, because if you wipe from back to front, it goes to the anal canal, from the anal canal into the urinary tract, and you get infection. What are the risk factors for this problem? Who get urinary tract infection? Straightforward, always female, because what? They have a very short urethra. Male, uncommon. But when we see it, I'm worried because the male has a very long urethra. So when I see urinary tract infection in the male, I'm thinking about upper infection. That means they have pyelo quickly. So you don't see urinary tract infection in male, but it can happen. When we see it, we really, really worry. Somebody who has indwelling catheter, they're going to get infection. So that's why you do your CAT-T, try to remove catheter as soon as possible. So far as you're not using it, we're going to remove it quickly and then prevent any problem. Okay. Now, the third one is somebody who have stasis. That means there is no flow. The urine stay in the bladder, and the stasis is a place for bacteria to grow. So that causes infection. So we don't want that. Then if somebody have recurrent infection, or the no infection, recurrent antibiotic use, they are risks of, they become immunocompromised, they are risks of UTI easily. So you should pay attention to that. Okay, so those are the risk factors that you should master. Now, let's take our cystitis. Like I said, straightforward question. Cystitis is a bladder infection. So this is a bladder infection. That's the easy way to, but it's the same as a lower tract infection. Whenever you have infection, things move faster than normal. When you eat food that you have GI infection, you get diarrhea. The same thing. When you have a bladder infection, the bladder will try to move faster. So you have what? Frequency to clear the infection, urinary frequency, and you have to go all the time. Urgency. So urgency is a problem. So that's why you got to go. You feel like you got to go most of the time. So why do we want to do that? So that's the problem. Okay. And so next, after the frequency, urgency, you're going to have, because of the inflammation, there's a risk of bleeding, hematuria. Okay, there's a risk of bleeding from the inflammation. So a little bit of blood, but that's not too much blood. Infections always causes pain. So you have dysuria. Okay, where would your pain be? The pain, they will always use this word. You know, the bladder is just above the pelvis. The pelvis is this lower portion area. And the way we call pelvis is pubic. Therefore, supra, on top, supra pubic pain or tenderness. That's what you're going to feel because it's on top of the blood and pubic bone. So that's what you're going to feel. You may have fever. So I would say plus or minus fever. Usually you don't get systemic features, but you may have it. The urine is going to smell, foul smelling urine. So those are the features you should be looking for when they give you a case, bladder infection, like frequency, urgency, a little bit of blood, suprapubic pain, and tenderness. And then they may have fever or the urine will look nasty looking, right? So those are the features you should see. Now, what do you think? You're going to order some lab. What are you going to see in your UA? It's going to be cloudy, right? That is not the most important. The most important is the presence of bacteria in this numbers. Nitrate plus leukocyte esterates. So it's leukocyte esterates. These are evidence of bacteria as they break down. So these are enzymes in them. So when you see that, you know this urine is infected. Okay, you may have WBC, white cells in the, and then some bacteria in the urine. Okay, you shouldn't see any protein. So it's plus or minus. Like I said, you may see small amount of RBC, but the most important is the nitrate and the leukocyte esterase. Those are the ones you should pay attention to, this and that. When you see there's infection, right? So that's the one I want you to pay attention to. So after this, you get to your lab and you saw this. What do you think the doctor is going to do? What do you think the doctor is going to do? Well, management, you're going to send a culture, right? So let's do some culture. We do culture, okay? Culture, and sensitivity. After we do that, then we give the patient antibiotic. What is the most common antibiotic they use? This one, don't forget it. Trimethoprim, sulfamethoxazole. This is the medication. It's very common. The common name is Bactrim. We use it all the time. It's the #1 treatment, outpatient treatment for UTI. What do you need to know? Your B-sharp moment for this? Or not the B-sharp, just go back. First, what are the key factors? This is a sulfur drug. So every sulfur drug, they have photosensitivity. You don't forget it. Most of your big medication are sulfur drugs. Then they can cause crystallization in the urine, so they can form stones. But the biggest one, okay, is Stevens-Johnson syndrome. That is your #1 B-sharp movement when you see it. And how would they present? Look for the word torso, okay, or chest, or trunk. And they will tell you there's a small blisters or rash on it. When you see it, yeah, that's a big problem. When you see that thing, yeah, that's a big problem. Blisters or small blisters or rash on the patient, yeah, you have to do something about it. That is beginning of Stevens-Johnson syndrome, and that patient, you have to see them as soon as possible. You have to see them. That's your B-sharp moment. For photosynthesis sensitivity, you just teach them to avoid sunscreen as much as possible. That's all. Okay, so that's their antibiotic. There's another antibiotic, so Nitrofurantoin. This is also very good. Okay, the side effect is nausea, vomit, diarrhea. Because of that, I want you to take it with milk or food so that you can tolerate it. But the biggest problem is it causes hypersensitivity. Okay, and this is pulmonary problem. They have pulmonary issue, and this is your B-sharp moment. When you see that B-sharp moment is a pulmonary issue. When you see that, stop the medication and tell the patient not to take it anymore. Don't take it anymore. Never go near it. Okay? The other thing too the board can ask you is not good in pregnancy. So you can't take it in pregnancy. So when you're pregnant, you cannot give it to them. What else? As we saw in the first question, you change your urine to what color? Brown, yellow, rusty color. This is normal, expected finding. It's not a B-sharp moment. So don't freak out. Don't freak out at all. That's fine. You tell the patient, this is what is going to happen. Don't worry about it. It's okay. Don't worry about it. The next medication, they may have spasm. They may have dysuria, painful when you pee. We have medication for that. This is a pain medication. It's anti-spasmodic to help with the spasm and the dysuria. Not spasm that much, but dysuria, painful when they try to pee. So it's Phenazopyridine. Key, this is not antibiotic. So you tell them, take all your antibiotic, finish it. Don't think I give you this, so you stop, because patient would think, oh, this is antibiotic, so I'm stopping it. Yeah, you need antibiotics. That's one of the teaching you teach them. You need antibiotic, okay? It's going to turn your urine into orange yellow. Why? Because it turns all secretion that way. When you cry, it will look orange yellow. When you salivate, orange yellow. When you urinate, orange yellow. Don't call the doctor. Those are all expected findings. Because of that, if you wear contact lens, I want you to remove it and wear glasses until you finish your antibiotic therapy. Put a pad under your pants, basically, because it's going to leak. Your bed sheet is going to look orange yellow. That is all expected. So don't freak out. Okay, this is all normal finding when you're on this medication. It's just for pain and it helps with the pain, but it does not fit and take care of the bacteria. So you have to take antibiotic. Okay. Now, how do you teach this patient so that he does not have this problem anymore? Teaching. Straightforward, right? I want you to drink 2 to 3 liters of water a day. Do that. Okay. Make your urine acidified. So do cranberry juice to help with that. It prevents that. And I want you to avoid irritants. I call them CATs. Okay, which are what? Caffeine, stay away. They are irritant to the bladder. Alcohol, stay away. Tobacco, stay away. And this one, spicy food, stay away. They are all irritants. You should stay away from them as much as possible. That will prevent urinary tract infection. Okay, then you should tell them to perform perineal hygiene. This is extensive, so because it's very important. Okay, they need to wipe from front to back, not back to front. That will cause bacterial introduction into the urethra. They need to wear cotton instead of and avoid synthetic clothing. Synthetic absorb moisture. Cotton is better, so that will avoid that. Where you cannot, no bubble bath, no douching or anything like that, douching or whatever. And when you have sex, avoid before and after sex. Okay? When you feel it, you got to go, go. So don't delay any void. Okay? And there's few things you have to teach them depending on the patient. If it's a kid, make sure you're changing diaper frequently when it's wet. If it's a male and is uncircumcised, they have to pull back the foreskin so that they can clean it every time. It's very, very important. And this is all the teaching you provide. And this is a good question that they can ask you. UTI, very, really impressive topic. So this is everything in the short form, summarize everything, high yield fact I've given you. Now, let's do the pyelo. I told you it's the infection of the kidney. Pyelo means bacteria. Nephritis is the kidney. So infection of the kidney itself by bacteria, right? So, and it can be that infection that has spread from the kidney, from lower portion all the way to the upper. Okay. The problem is this is a serious infection. Okay. And how did they present? They're going to have systemic manifestation. So their symptoms are generalized. So they can have nausea, they can have vomit, okay? They have fever and chills, systemic, really bad fever and chills. And they will have pain, but the pain is not suprapubic. Look at where the kidney is. The kidney is all the way in your back. It's not near the bladder. So they will have frank pain that if this is the belly button, it go into the belly button. So the pain go this way. So this is the key that you have to watch in the case form. So they have flank pain, then it radiates to what? The umbilicus. It does not go to the groin. It radiates to the umbilicus. That's key. And they may give you this costal, okay, it's very key. Costal vertebral angle tenderness. The best way to remember is the same as the frank. It's on the side, costal vertebral. It's between the costal area and the vertebral, the angle, and it radiates. So they have costal and vertebral angle tenderness. That is classic for what? Pyelonephritis. So don't forget that. So that is the key. That radiates. It will radiate into the umbilicus. It's the same thing as the flank. If they don't use the flank, they'll use costal vertebral angle tenderness radiating into the flank areas. The other thing you should know is, look, the blood pressure can change. So hemodynamic changes. So that's what you pay attention to. Okay. The same thing. You get a UA. For this patient, they're very, very sick. These patients are sick, so they have to be admitted to the hospital. Okay, you get a IV placed, IV fluid, because they will be like in shock form, and then you get a culture. How do you obtain the culture? I did not mention in the first one, but this is the midstream clean catch. That's how you obtain your culture. Mainstream clean catch. So we obtain the culture. After we obtain the culture, we give them broad spectrum antibiotic. That means we don't know what the bacteria is. So we give them broad spectrum to take care of all form of UTI bacteria while we wait for the culture. Don't give them antibiotic before your culture. Take the culture, mainstream clean catch, and then send the culture, and then you initiate the antibiotic. If you already have an order, you could do the specimen first before you start the prescription. Then after that, like I said, this guy has to be monitored carefully. Okay, you have to monitor them carefully. What is your biggest problem? B-sharp moment for this is urosepsis. They're going to get sick. So you got to monitor for sepsis. What do you look for? What? Tachycardia, hypotension, change in mental status. Those are the key you're looking for, okay? If they give you a case, 81-year-old lady come in, confused, and the urine, most of the time, is confused. Every old lady that comes in confusing. If you don't have any source of confusion, think of a UTI. This is the most common case they may present to you. They are urosepsis. They will give you a case, but you don't understand it. They keep on talking about it, but there's no evidence of Alzheimer's, nothing. Why is this lady is delirium? It's UTI right there. That's always the problem. So pay attention to that. So they will need antibiotic. They will need to be monitored for sepsis. And then when they do better, you give them same precaution like we discussed about, but that is the management of pyelonephritis. And the symptoms, frank pain, systemic symptoms, goes to the groin. Pay attention to the groin, okay? Sorry, frank pain go into the umbilicus, not the groin. Frank pain to the umbilicus. Once again, frank pain goes to the umbilicus, okay? And costal vertebral and angle tenderness and systemic symptoms is pyelonephritis. The next one is kidney stone. Guess what? They will use the word nephrolithiasis. What is nephro? Kidney. Lithiasis is stone. So that's why they call it kidney stone. Nephro is kidney, lithiasis is stone. You have to know that how did the stone form? Stone form because the urine composition changes. It's the same thing as how you form gallstone in your gallbladder. The composition of your bile changes. When the composition changes, the urine crystallizes and forms stone. That's all. Then you have to know what kind of stones do we have. We have the calcium stone, which is normal one, okay? Then we have uric stone, which is usually gout or high protein diet or turnover, basically. And then we have this third one, Struvite stone. It's due to like somebody who has a recurrent infection. They have a recurrent infection, they form this large stone in their bladder, and that is another source that you should know, Struvite stone. So these are the type of stones you have. What is the risk factor? Why will some people form stone? Where I told you, it may be too much calcium, it may be too much uric, or infection. So think about it. Somebody who has too much calcium. And what are those? You have disease process like hyperparathyroidism, too much calcium, or you take too much vitamin D. Vitamin D is needed to absorb calcium, but calcium is not needed to absorb vitamin D. So if you take too much vitamin D, you're absorbing too much calcium. Okay, so that's another problem. People who doesn't move, so immobilized. If you don't move in bed, you release too much calcium. So this causes hypercalcemia. That can do that. When you dehydrate it too, your calcium concentration may change. Okay? What is another risk? People gout. If you have gout, you form more crystals, right? You have a uric acid production that can form that. Okay? And then people with chronic infection, be likely to form more stones. So these are the risk factors of stone formation, depending on the origin. Okay, the top one are calcium, gouty for uric, chronic for infection for Struvite stones. So what do you think you will present? Like we talk about, this is key. Look at it. I told you bladder, that cystitis, they have suprapubic pain. Your test is pain is always location. When you have pain, it's located at the organ where the organ is affected. If you have a heart problem, your pain will be on the left chest. Okay. If you have pyelonephritis, you get pain in the frank that go to the umbilicus. If you have what? Kidney stone, which is nephrolithiasis, is down where the kidney is. So the frank, but where does it go? It goes into the bladder. So you follow this pathway. So this is kidney stone. The kidney stone go this route. Okay. So this is, if you have kidney stone, you go here like that. This is where you go with your kidney stone. If you have pyelonephritis, you go like that. And nephrolithiasis, you go like that. So this is your key. So that's the difference between them. So for kidney stone, I'm looking for what? Flank pain. First, it has to be acute, all of a sudden onset of flank pain. Where does it go? To the groin. And usually it's unilateral, it's one side. One side. It go into the groin. That is the key. And it's colicky in nature. It go in waves. Okay, back and forth, waves. Okay, it's not constant. It goes in waves as the kidney stone move. Okay, they may have nausea from the pain or vomit from the pain. And because the stone is irritating the bladder and the tube, the urethra, you're going to have bleeding. So they can have gross hematuria. This is a lot of blood. It's not a little bit like in cystitis or pyelonephritis. This is a lot of blood. Okay, and they may, if it blocks, this is the concept you have to learn. If he block, okay, if he block the stone block the urethra, the ureter. So this is the, oh, I took it off. So if this is the, let me clean it up. if this is the kidney, this is the bladder. If the stone block here, okay, it can block here so that urine doesn't flow. You're going to have the urethra get bigger, the urethra get bigger, and urine stasis go there, and it can get infected. So you can have dysuria from blockage. If it block, and you can have signs of UTI, dysuria. So that's possible, and that's what we call hydronephrosis. That means you make the ureter bigger, and the fluid retain over there. So pay attention to that. Now, how would I diagnose it? We don't need to do culture because it's not an infection. You get a CT scan. CT scan, no contrast. Some people say sometimes you can use ultrasound for a pregnant lady or anything like that. But the best CT scan, the best study is CT scan, no contrast. Okay, management, this is very important. Management, this is very, very painful. So give them pain management. Most of the best pain management are NSAID and ketorolac. This is the best one, NSAID. But you can give them opiate also. But NSAID is your best point. You can use non-pharmacological, like heat pad, okay? You can also use it to it. But if you have to give them something, give them what? NSAID as much as possible. Okay, so that's that. And then what do you do the next? Okay, you need to strain all the urine. Why? Because I need to know what kind of urine or what kind of stone you form. So if it's calcium oxalate or calcium stone, then we can do analysis of it. If it's uric stone, then do analysis of it. So all the urine need to be restrained so that we can analyze it. It's because of the study. So that we can do the study, then we can figure out what causes your stone, and next time we can treat you for that. That is the key. So if you see a question like that, strain all urine as much as possible so that we can do a study of them and we can figure out what kind of stone you form. That's very, very important. Okay, now, precaution to prevent future attack. You know it, right? 2 to 3 liters. Drink a lot of water a day, as much as possible. Okay? If it's a calcium oxalate stone, you got to teach them that. The oxalate is usually from spinach or tofu. They're very, very common, or maybe potatoes. Those are the common ones, okay? And it happens because you absorb too much of the oxalate in your GI tract. This is a little bit confusing to understand. Why do you usually you have calcium, the calcium bind to the oxalate, and it prevents the oxalate from absorption. And this one you poop it out, okay, by movement. If there's too much oxalate, yeah, it leaks and it get into your blood and it go to the kidney and you form stone. So in order to prevent it, okay, you have to teach the patient specifically. I don't want you, okay, make sure you have normal calcium intake as much as possible. Don't lower your calcium, even though you form the stone. But because we know it's oxalate and we have to prevent more oxalate from absorption. So make sure your calcium is normal as much as possible so that the calcium will absorb the oxalate. If your calcium is low, so if you take low calcium, this will lead to oxalate absorption and you get more stone. Counterintuitive. Oxalate stone, teaching you provide for the patient, maintain normal calcium. I don't want you to increase your calcium. If you increase it, then you form stone associated with hypercalcemia. I want you to have a normal so they can bind the oxalate, and that will take care of it. If this is it's a uric stone, yeah, so avoid high protein, gout kind of treatment to avoid high protein as much as possible. And if it's recurrent stone due to antibiotic, yeah, or due to recurrent infection, so we have to treat the infection and prevent recurrent infection. That's all. And the last thing I want to talk about is sometimes what we have to the stone is lodged in the place where you cannot pass it. Okay, if this is the kidney and this is the bladder. If the stone is lodged here, we can break it, or they are all here, they're causing problem here like that. There's a procedure we can do to help with that. We call it lithotripsy. Basically, breaking the stone with laser. That's all. Break it with the laser, and that will take care of it. And when it happens, you form small stones that will be able to pass, easily pass. Okay? So what do you do the next? Pre-op, okay, they have to be MPO. This is very important, MPO. MPO, and you have to make sure they have a consent. After the procedure, you have to look for the stones. So you got to still strain the urine to look for the stone, make sure they pass it. They're going to have fragmented urine with stones in it. Okay, that's fine. They may have some bleeding. This is small blood, so hematuria, no gross. It should not be like massive. This is a little bit of it. If you see massive, it's a problem. They may have bruising in the flank. That is okay. Okay, that's very, very, and they may have flank pain, okay, because we burned that area. Anything than that is a B-sharp movement, but these are things you should expect. Okay, I should expect stone in the urine, some fragmented stone in the urine. I should see some a little bit of blood, no big blood, okay, no gross hematuria. And then they should have bruising, what do they call it? Bruising on the flank. And then otherwise, the rest, it should be normal. If you see anything more than that, that's a problem. So this is the concept I want you to master. Be able to distinguish between these three things. What? Cystitis, pyelonephritis, and nephrolithiasis. Cystitis, suprapubic pain. That is the key. They don't have a lot of blood in their urine. Urine is dark. Pyelo, frank pain, costovertebral angle tenderness going to the umbilicus. They have systemic symptoms. You're worrying about sepsis, kidney stone, frank pain going to the groin. They have pain, so pain is your management. If they have blockage of the stool of the stone to the ureter, you may have hydronephrosis, and they may get infection from it. That's how they can develop pyelo. So one of the complications of kidney stone is pyelonephritis if there's a blockage is not being relieved. and that become a problem, is due to stasis of the urine. 3 concepts for your NGN and standalone question. Adapt and place out. Take care of yourself and subscribe and follow the series. All the best of luck. Bye.